classical formula could really help patients and help us practitioners. So this case is about PMDD. So PMDD stands for premenstrual dysphoric disorder. So we are familiar with PMS, but maybe we don't hear so much about PMDD. So basically, PMDD is more severe form of PMS. So severity of symptoms, really affect the quality of life of patients. And often it can be diagnosed by psychiatrists, psychologists, really affects their mental as well as physical aspect. Oh, no. PMS, there she is. She goes, I'm fine, I hate you. Oh, sorry, I'm fine, I hate you, I love you. I want ice cream, come here, get away, oranges, So I think we can all relate to this kind of crazy, physical, emotional space our hormones can get. And ETCM, as we know, there's yin and yang, qi and blood, liver, spleen, kidney, heart, all these different organs, different entities, expression of energy are supposed to work in harmony, like a symphony. And when that's off, we can really feel it. So, yeah, with PMS, what type of symptoms can you think of? For a moment, you can type in if you'd like. And what is the common diagnosis that we, learn from TCM school? This case will just kind of introduce you just a little bit different look at the PMS as well. I hope. So let's take a look. Premenstrual syndrome, PMS, is very common. And according to Mayo Clinic, it's estimated that as many as 3 out of every 4 menstruating women have experienced some form of premenstrual syndrome. And again, PMDD is a severe form of PMS. Mood swing, moody, acne, headache, pain. So my case is SY, female, age 35. She works in a tech company, very typical, educated, driven women, really smart. And this is her case. So symptoms are so severe, last for 1.5 to 2 weeks before period. So really affecting her work and quality of life. And her period, you will find out that it's very difficult for her. And, so 1 week plus 2 weeks of PMDD or PMS. So pretty much she only has 1 week of feeling normal. So that's really not how, how she wants to live. And so that's when I started seeing her. She has a lot of symptoms, but one of some of the symptoms that really affected her and her life: severe fatigue, brain fog. She can't, function properly with work, can't think properly with work. Really deep depression or severe anxiety. So really swinging at times, before period, insomnia. She can't sleep very well. She would get headache. And other symptoms also that may be significant for us. Her cycles are actually regular. So about 28-day cycle. So not too long, not too short. It may range 2 to 3 days, but pretty on time. But she does have pain for 2 days. And then she gets headache during and before period, cramps before period, loose stool during period, low back pain before and during period. Period flow is heavy flow and dark red and clots for 2 days, and total flow is 7 days. So as I mentioned, period is 7 days, and she gets a 1 week of feeling normal, and then she gets into these bad feeling again. So she also mentions complaints of bloating, acne before period. She has she wakes up to urinate. She has strong sweet cravings before period. So a lot of symptoms. So let's see what everybody is thinking, looking at these symptoms. Other symptoms in health history. She has also had psoriasis, or at that time I saw her, she also has psoriasis, scalp, ears, left lower leg, itchy, scaly. Psoriasis was, she was dealing with that with her dermatologist, so Western route. So that was something, she, wasn't looking to address with TCM at that time. So, but that's definitely part of her picture. History of ulcerative colitis. In the past, diagnosis was 10 years ago, no flare up for 5 years. So her digestive system has been, fairly stable for 5 years. Symptom at that time, 10 years ago, vomiting, multiple bowel movement, diarrhea, abdominal pain, did steroid and methylamine. Currently daily bowel movement, no abdominal pain, bloating often, cold body tendency, cold hands and feet. She complained that she's overweight. In the past 2 or 3 years, she mentioned that she had gained weight, 25 pounds. Ideal weight is 125, and she really mentioned that she wants to lose weight. She exercises, but she just cannot lose the weight. So energy generally good, except second half of the month really tanks and sharp, like fall. So it was really hard for her. Sleep is 8 to 9 hours. No difficulty with sleep except second half of the month. So what was also interesting about this case was she was referred to me by my friend acupuncturist, but out of state actually. She was getting regular acupuncture before she moved to LA from Seattle. And so with this case, it's interesting, definitely I saw the power of herbs. We know acupuncture is very powerful and can be very powerful on its own. But once we started incorporating herbs, she just felt the results fairly immediately, actually, which I was like, wow, this is so great. So this really shows you like the power of just adding herbs to, a lot of the cases. Tongue was pale, dry, red tip. I'll talk about this later, but I was just noticing her tongue is just very, very dry. Pulse soft and deficient in chi position. When I palpated the abdomen is kind of soft. And observation, her facial complexion is kind of sallow, slightly yellow. She is Indian. So my TCM diagnosis, it's a lot in here, but you'll see why. I saw liver chi stagnation leading to heat in the heart, heat in the blood, causing insomnia, spleen chi deficiency, more of like a foundation, her constitution, her history dealing with the UC, blood deficiency leading to blood stagnation, hence psoriasis, itching, dryness, red, heat in the blood, all that also tied together. And then also kidney chi deficiency with the urination at night, low back, pain, like dull achy before period, so things like that. So that was what I saw. What pattern do you see? What herbs and formula comes to your mind? Acupuncture point. It's pretty straightforward, addressing kidney, liver, gallbladder to also address stress, clearing heat, calming the shen, nourishing blood. So you'll see all that. So it's pretty typical. I would change sometime, but that's pretty much, her points were pretty much similar throughout. And she loved cupping. I don't know how many of you do cupping in the practice, but in our practice, with Dr. Lee, Stella, Sally, Agnieszka, we do a lot of cupping and patients love it. And I also gave her ear seed, ear shen men after acupuncture. So this is the formulas I prescribe. I was just remembering Dr. Lee teaching me about these two formulas and how wonderful they can be. But I also actually saw the pattern really fit with her. So that was the first a prescription I gave. So we use TCM Zone herbal packets. So it's pretty easy for patients. They just grab 2 packets and then they take twice a day. I also advised her to incorporate protein shake daily because she was working out, and she noticed that sugar craving like lessened with that as well. So progress. So her initial visit was day 22 when I saw her, and follow-up session, I saw her 2 weeks later, which she had periods by then. And she actually reported much improvement on many of her PMDD, premenstrual symptoms. I was like, actually kind of surprised how well it worked. Depression, anxiety, period was better, cravings were better, sleep was better. I was like, wow, feeling overall just very stable. And overall, symptoms weren't gone, but a lot shorter, really manageable symptoms, more stable. So after three months, 7 sessions, PMDD and dysmenorrhea continued to improve, symptoms not affecting her work or life very much, so patients feeling stable. She was also able to lose 10 pounds. So I was like, wow. And so this really showed me when you support your foundation, everything else starts to actually take care of itself. So she was, of course, very happy. And just to summarize, after 6 months, I saw her, I think, fairly consistently. But she wasn't one of those patients who come every week. She would like come every 2 weeks, sometimes every weeks, but herbs really help her to stabilize her symptoms. So this was a really, it was good for me to see, wow, herbs can do a lot, which we know, but it's good to get a confirmation. And after 6 months, patient wasn't taking herbs anymore. Symptoms are still stable. Great. After that, I saw her here and there, a little bit of, flare up when the stress was high, but just she's off of herbs now and lost the 25 pounds she wanted to lose. I saw this like a different woman. And I was like, very, very empowered actually, and really happy for her. So yeah, that was the great case when the patterns really fit patients. I think we can really have a really good success. And then for her case, I will explain a little bit, but I think there was a chi dysregulation, rather than blood or damp or phlegm, so I think for that, I have another PMDD patient who has damp and who has more blood stasis and stagnation, and she's actually this particular patient, another patient's, taking longer to respond than like this patient, but this another patient too having good response with the classical formula. But this is also a really good example. Again, this patient I'm presenting now, when the right pattern, also meets the right formula, patients feel so much better. Even though there was this list of symptoms just so long, but she just felt better. So this, I think, was a really great example. There she is again. Let's talk a little bit about that. So here's a list of symptoms, just kind of reviewing everything, what people could, patients could experience. So there's a lot of symptoms. I'm sure a lot of you have seen, patients experience host of symptoms. And in school, we learn, for what I remember, PMS, liver qi stagnation, but now I learn a little bit more, a lot more about the classical formula. And there's kind of a depth of how we can really expand or the way we really see patients. And with PMS and TCM, I want to just kind of explain this main, qi, blood, and water for women, so we can see qi area. This is kind of exactly what I saw in her, actually, beyond, liver qi stagnation. And what prompted me to choose the Dangui Xiaoyao-san and Guiju Fulingtang over, like, let's say, Jiawei Xiaoyao-san. That's kind of a typical formula we learn in school. So qi, right? Disruption flow qi could be qi stagnation or counterflow of qi, or qi deficiency. So that can manifest emotionally, that can manifest physically, which she had deficiency symptom. She had the swing, she had the depression, she had the headache, and blood, in the realms of blood, disharmony of blood stagnation, stasis, heat in the blood, deficiency of blood, which also she had, anxiety, insomnia, again, headaches, cramps, pain, and then water, right? Disharmony of water, stagnation or accumulation of water, or water dysregulation. What prompted me was like how dry her tongue was, actually. And then, just water just not reaching to the area properly, and then possibly manifesting, in bloating, also like her psoriasis, along, of course, with the dysfunction in blood. So, and looking at these just three realms really helped me to understand, what to choose, classical formula as well. So there she is again, just looking at her symptoms. So she, mentioned already, she had the loose stool, brain fog, fatigue, liver depression, kidney qi deficiency, like almost like I saw like kind of yang qi floating, like not enough yang qi or weakness. Hence just kidney qi weak, not able to hold urine at night. Also like brain fog, qi not reaching the brain, kind of a deficient heat floating up, like acne. I didn't see like excess heat for her. I saw this kind of deficient heat like flowing up, yang qi floating, kind of anxiety, like that was kind of what I was seeing. Liver blood, like blood realm, blood stagnation, headache, period cramps, and heat in the blood, like really making her anxious and, couldn't sleep at night. But also this like stagnation's kind of rooted in the deficiency as well. So, and then water realm, like I said, just water not reaching to skin or tongue, or looking at her tongue, I was like, it was not a, typical like Jiawei Xiaoyao, red size, that kind of tongue. So that's why I also didn't choose the Jiawei Xiaoyao-san. And I was like, oh, there's something, liver, spleen, kidneys. So, and then some blood stagnation, a little bit of yang qi. All these two formulas address. So let's look at that, okay? Dangri is, traditionally famous for treating various type of gynecological inflammatory conditions, including dysmenorrhea, threatened miscarriage, to infertility. How common is painful period? It's very common, 16 to 91% in individual reproductive age. By the way, all the statistics I do have references. Like if any of you would like it, I can give you. Here is what's in Dangui Xiaoyasan, everybody. Dangui Bai Xiao Chuanxiang Fulin Bai Ju Zexue. Nourishes liver blood, move liver qi, move and harmonize blood, strengthen spleen, resolve dampness, strengthen kidney, support water metabolism. So what do we see? Liver, spleen, kidney. So I saw this when I saw her. So that was the reason why I chose. I wanted to also introduce some of the research. Knowing research, what's established in modern scientific research also helps us understand better about formula, and then also helps patients understand better about the formula and their healing. Although I think it's important for us to really have the good, excellent TCM theory and understanding for sure. But now we're working on integrating with other healthcare providers, doctors, I think it's always good for us to be aware of research and studies. What's known about Dangui Xiaoyao-san is that Dangui Xiaoyao-san reduces inflammatory markers such as prostaglandin. These prostaglandins are elevated in patients with dysmenorrhea. So there's a correlation with that. Prostaglandins are like group of lipids and with the hormone-like actions, but there are several different types, we won't get into that, this is beyond the scope of this, CEU, but just so I give you a little bit of background, has the antagonistic action on the uterine contractions, and that's Dangui Xiaoyao-san, and hence it's very effective for treatment of dysmenorrhea. So since dysmenorrhea is very common, so we have a solution to our community and patients, because herbs are safer, healthier alternative than NSAIDs or over-the-counter pain meds. Some women take a lot of pain meds and all the time and often. So definitely hard on liver, kidney, GI system. So we have a lot to offer. So here's what's very interesting. Prostaglandins are considered inflammatory, However, this group of lipids, hormone-like actions, play an important role in women's health and reproductive health. I wanted to share a little bit about this because I saw, wow, this is like the, yin and yang, qi blood, in works. So prostaglandins, this is one of the example, so many miracles of our body, I feel like. So conception and implantation, actually prostaglandins actually are very much involved, helping implantation and conception. And number two, when you ovulate, your corpus luteum has to dissolve. Otherwise, you end up with ovarian cyst. So prostaglandin also is involved, or observed to be involved with proper disintegration of the corpus luteum. So that's also interesting. Number 3, we know menstruation, proper shedding of the lining. We know when our linings, we don't shed properly, then we start to have an issue, So we have patients who come in, their doctors, gynecologists told them, you are building too much lining. You have to, shed. Even though they have periods, they don't shed in an efficient manner. So then they start to have all kinds of like inflammatory related issues. So that's also interesting. Proper shedding, but not too much, right? If it's too much, you end up with dysmenorrhea, too much blood, too much pain, so there's this balance. Number 4, prostaglandins are also involved in childbirth, smooth, hopefully flow of childbirth. So I thought that's very interesting, that we have these, chemicals in the body, and they are supposed to, just work, right in the middle, not too much, not too little, but right in the middle. Just like yin and yang needs to be in balance. So conception and implantation, just a little bit about that. So here I feel like it's like, again, yin and yang at play. So prostaglandins are essential for health of normal tissue, right? And then appropriate functional changes of endometrium, blastocyst growth and development, so it's like the yang qi, like qi, qi movement, building up yin, blood, white blood cells recruitment, so proper immune, functions, embryo transport, so the embryo needs to flow in the fallopian tube. So that's like a proper qi movement, qi flow, trophoblast invasion. So that's when the thin layer of cells that helps developing embryo attached to the wall of uterus. That's where the implantation happens. Protects the embryo, forms a part of placenta. Also extracellular matrix remodeling during implantation. So conception and implantation, there's all these like just different activities that's supposed to happen, and then these guys are involved. Yeah, I think I mentioned, number 2, if you don't, dissolve the corpus luteum, you get the cyst, menstruation, childbirth. I think I mentioned that. And there's a lot more pharmacological effects, antioxidant, anti-inflammatory, anti-dementia, and then also helping with the diabetic neuropathy. So there's a lot that this formula can offer. Guiju Fuling Tang, no, I need to speed up. Guiju Fuling Tang Baisal Murampi invigorates blood, transforms blood stasis, resolves dampness, phlegm, softens lump. I wanted to introduce a research. So what's known about Guiju Fuling Tang is anti-tumor, inhibits uterine fiber growth, as I think a lot of us know about this formula. Analgesic, alleviates severity of menstrual pain, primary dysmenorrhea cases. Antibacterial, anti-inflammatory, anti-fever, regulates the endocrine system. So this is great. So that's why this can be effective remedy for chronic pelvic inflammatory disease. And I saw one study, they think that with this use of, formula, we can use less antibiotic and less NSAIDs, and that will be good for patients. So yes. So other common formulas for PMS, of course, just to get to San Francisco, you don't have to take one way, right? There are so many different ways to get to San Francisco. So there are different ways to treat this PMS, and always important to diagnose, do a differentiational diagnosis and figure out, what's going on in each patient. I have a patient who I'm treating right now, and I mentioned it earlier, she has a very different presentation, even though her diagnosis is also PMDD. So I use Shifo because she has more blood stasis. And then Kanning-san, because she has more damp and like middle jaw stagnation. And then also Tiajin-wan, because she has also young, kidney yang deficiency and spleen qi deficiency. So I combine 3 formulas and she is doing better. Oh, there you go. Yeah. So, but here is the formulas you can choose depending on qi, blood, water, like what is happening with these 3 major system of a woman, and then you can actually pick a formula effectively. Thank you so much. That was my presentation.
Thank you so much, Dr. Kumiko, for your presentation. Do you guys have any questions for her?
It's Natalia Pastolati. Can I say something?
Yes.
Thank you so much for this presentation, because what I think the premenstrual syndrome or premenstrual dysphoric disorder, it's very, very important subject we have to talk about, because of the I think it's a kind of, we have now like a social construction of this diagnosis, because it's now very popular diagnosis, or I would say diagnostic label, among the medical professionals, and like in general in the public, and women, when they just explore that they have this diagnosis, or I think it can just bring a damage to the women know that it's like premenstrual syndrome or premenstrual dysphoric disorder. And we have to talk about that like loud, and like, especially because TCM can help a lot. And the women, they can just can stop taking a lot of medications like fluoxetine, what I know they prescribe a lot, what is just like awful medication for this special disorder, and we can treat it very, very successful. Thank you so much. I think it's very important. Thank you.
Thank you, Dr. Natalia. I just want to say she's a doctor with lots and many years of experience. So she's an immunologist and now TCM doctor. So really, really great to have you. And you're absolutely right, because I see fertility patients who have been on birth control pill because her PMS and also dysmenorrhea. And then she was put on antidepressants, and then she also takes Adderall for her ADHD. And then now, like, she's wants to get pregnant, and we need to, like, she's off of birth control, and her period is not coming properly. And then she has to get off of, ADHD medication and, certain antidepressants. And it's just like, if we can help, women at, with painful period or PMDD or PMS, then she didn't have to go through all that. So that's why, I'm really, we have actually a lot to offer. So that's what I wanted to show you tonight. And I'm glad, you also feel the same way, like we can do a lot for our patients. So thank you. Casey? Are we doing something or?
I
You're
need you to
muted.
stop sharing your. I need you to stop sharing your screen.
Okay, sorry.
Okay. For your lovely presentation. Can everybody hear me all right?
Yes.
Yeah. I send you guys to a quick 10-minute break. I do want to shed a spotlight on one of you today. So today we want to shine a spotlight on Dr. Christina Illuminafi, who is doing amazing work focused on psychological distress disorders in children and teens, as well as chronic viral health conditions. And she's currently seeing patients in Trinity Herbal TCM. Does anybody?
I just want to chime in a little bit because we are losing Casey's audio. So yeah, welcome Dr. Christina. And we wanted to spotlight our practitioners, yeah, there she is, each class if possible, because that's part of like building community, you know, also whenever if we have patients who need care in Torrance, we have Dr. Christina, and actually Stephanie Young is also joining us tonight. Nice surprise at last minute, but great. And they have a wonderful clinic together down there. And so if any of your patients need care in South Bay, and then they are awesome. And also at Yosan, you know, I have sent patients to Dr. Christina there. You know, she believes in supporting community, so she still does her work there. So yes, so that's our community. So thank you. So I think Casey's audio is gone. So I think, is this the time for a break, Casey?
Yes, right.
Yes, oh, she's back. Okay. Go ahead, Casey.
Can you guys hear me now?
Yes.
Oh my gosh. Okay. Thank you so much, Dr. Kamiko, for taking that on. Yes, it is time for break. So we will have a quick 10-minute break. We will come back in 10 minutes, so around 7:05, I think. And we'll then start listening to Stella's case for today's class. Thank you so much. We will go on a break now. Okay, everyone, I want to start gathering everybody's attention again. We are going to start our next case study. Stella Kim will be presenting her cases, so we'll give you guys a minute to start coming back.
Hi, everyone. Can everyone hear me okay? Awesome.
Yes.
Great. So I will start with my case. Just to do a short introduction about myself, my name is Stella Kim. I'm a licensed acupuncturist, and I'm also the director for Herbal TCM. You might recognize me from some of our previous events in the past year. I've been part of Herbal TCM and the clinic. Our clinic name is Art of Chinese Healing. And so I've been part of this team for a couple of years now. And so I've had such great opportunities to not only, build our Herbal TCM wholesale side, but also to grow as an acupuncturist. And so I am very grateful to be here, to be able to share this very interesting case that I've had the opportunity to share with Dr. Lee, who I have been following and shadowing the past year and have learned tremendous amount, as you all know. So I just wanted to just open this time up. If you guys have any questions during my presentation, feel free to chime in, but I'll just go straight into it. So my case study was a post-COVID immunology case, which Dr. Lee and I both co-treated this patient. And so wanted to share with you all this very interesting case. So this case was, sorry, let me just go to my next. So this case was of a female, 69-year-old female. She's 5'7", 122 pounds, white, married, and an author. She is semi-retired, so she is, she does mainly a lot of engagements, writing engagements, and teaching at her own time, which she loves to do. So her chief complaint was left foot pain. Primarily, just to go into what that pain involved, it was only on the left side due to blister, so blister pain. And the onset was in July of 2021 after she got sick. And at that time, that was kind of in the thick of COVID. And so, she didn't confirm whether or not it was in fact COVID. However, I think at that time there were a lot of variable with the tests, when to test. And so, she couldn't confirm that it was COVID, but she did get very, very sick. Typical symptoms like chills, fever. She also presented with sore throat, cough, fatigue, and headaches. So on her left foot, we observed redness, swelling, And she also expressed that it emanates heat. It feels very hot. And it occasionally feels numb and also turns purple as well. And just for context, her right foot is not affected at all with these specific pain symptoms. So these blisters are mainly at the base of the 4th and 5th toes. Occasionally, she does get blisters at the base of the big toe and also at the plantar surface at the bottom of her foot. There will, from time to time, be pus present at the blisters, and these occurred for her about once a month, every month. And so when we saw her, she was about a year. We saw her in 2022. And so she was about a year into this condition. And so prior to her seeing us, she had seen, various specialists, dermatologists, rheumatologists, and, most of them just could not really quite put a firm diagnosis on it. At one point, her dermatologist did diagnose her with chronic herpes of the foot. And so, that was what she came in with, presenting. So her pain was frequent, almost constant, and the pain level was quite high. It was at an 8 to 9 out of 10 when she would have these flare-ups. Any heat would aggravate her pain. And she also reported that it was very, very sensitive to the touch. And so any shoes, any socks, any thin material, even the thinnest of materials that would brush against her foot would cause discomfort. She stated that the blisters would get worse when she was especially stressed, or if she had a cold, flu, and with overexercise. So this is a photo that we retrieved from her in the early stages of when this happened. And she's a very organized, very meticulous type of patient, such a good patient in terms of she documents everything. She journals her symptoms. And so, that was very beneficial for us for the case. So this was in July 2021, following her sick episode. And so you could see the discoloration, the slight swelling, especially in the 4th and 5th toe. You see the open wounds there, although I think some have healed over, scabbed over. There's a little bit of pus there as well. So this was what she presented with as well in the clinic. So just some background medical history on her. So she was diagnosed with hypothyroidism, Hashimoto's, and Raynaud's many years ago. She mentioned she did get this diagnosis in her 20s. And throughout the development in the course of those syndromes, she developed chronic fatigue, which was debilitating for a while. She also suffered from migraine headaches, anxiety, and tinnitus. She also has a family history of diabetes, although she herself did not have any diabetes. And so some of her medications, or not all of her medications, are Valtrex, 500 milligrams, which is prescribed by her dermatologist following this skin condition. She also had a hydrocortisone cream in the initial stages of when this condition began. She normally takes levothyroxine, liothyronine, testosterone, Biest cream, progesterone, DHEA, and tretinoin cream, which is not related to the foot. This is more for her under eyes. And then some of the supplements that she took are multivitamins, vitamin D liquid, and vitamin K. She also took a CalMag citrate. She also took a niacin, berberine, and lion's mane. Just a background on her dietary and lifestyle. So she reports having low appetite. She would say oftentimes when I ask about her appetite that she sometimes forgets to eat. She was a very thin-framed patient. And so, she looked a lot taller than she was. And so, she would always mention that, oh, I'm trying to gain more weight. But she just was always unable to gain the weight due to, various reasons, but mainly she just would forget to eat or just wouldn't feel hungry at all. So most of the time she would eat a vegetarian diet with occasional fish. She did drink about 40 to 60 ounces of water per day at most. No history of alcohol or smoking, occasional caffeine with tea. And as an author, semi-retired author, she's very active in political circles and social groups in her community, which she had mixed feelings about. She was, excited at times, and also it was a source of a lot of anxiety for her at times as well. She exercised regularly, about 4 to 5 times per week when she could. But during the times when she would get flare-ups, it would be very difficult for her to even go walking because of the pain in the foot. So in terms of her energy and her mood, so I mentioned she had a previous history of chronic fatigue, which was mostly resolved, but occasionally she'll get bouts of low energy and also low mood, to the point of depression at times. She does experience anxiety often, with feelings of worry, fear, and she referred to herself as a perfectionist. She does have a good support with family and friends. And in terms of her sleep, she had difficulty with staying asleep and would wake about 1 to 2 times per night on average. She would have more wakeful sleep when her left foot was flared up, because she would wake up from the pain of feeling either like her bed sheet brush against her foot, or something just hit her foot, and that would wake her up due to the pain. So she wakes up very tired, but is able to get through the day most of the time. Her digestion and bowel movements were more on the sluggish side. She would describe them as being just, I think that also she mentioned that she doesn't eat very much because she feels full quickly. She also mentioned her bowel movements sometimes do feel more sluggish, but she does go every day, sometimes every other day. They alternate between loose stools, diarrhea, and constipation. This patient does have a history of hemorrhoids, which we also treated as well. The hemorrhoids did present with pain and bleeding as well, which was significantly improved with Chinese medicine and herbs. Next slide. Oops. So next slide. So as I mentioned, per her dermatologist, they diagnosed her with chronic herpes lesions. And I later found out that there were no biopsies really taken of the area. And, when we did request, a possible biopsy for her foot, the dermatologist was, pretty much waiting for a time where the actual lesion was active. And so in terms of the timing part of that was a little difficult for the patient. And so we eventually never got a biopsy, or at least at this point. But some of the other differential diagnoses that came to mind, so we have the herpes simplex lesions of the foot, and then we also have a condition called chilblains. So this was something that came to mind after a period of time of treating her. just trying to, figure out different approaches, different ways to treat her. And I came across this condition called chilblains, also known as pernio. But just a little background about that. Sorry, give me 1 second here. So chilblains is a dermatological condition that presents oftentimes as erythema, a lot of swelling, redness, inflammation of the feet and hands. This affects mostly children, interestingly enough, and often resolves very quickly within a few weeks. During the pandemic, there were a lot of more instances of skin manifestations and skin conditions popping up. And so a lot of dermatologists at that time were, they were getting all of these cases with people presenting with this lesion on the foot. And so, research has been done on this chilblains, but there isn't anything still conclusive on whether or not it's specifically related to chilblains or not. So they're still researching what the causes of the condition really is. And so chilblains, what I found was it's different from what they now call COVID toes. Now, COVID toes presents very similarly to chilblains. They both present with lesions on the feet, redness, blistering, pain, discolorations, but the differentiations are still not clear, but they are presuming that there are slight differences between the two. And the interesting thing is that COVID toes, the reason why they came up with that term was because all of these cases that were coming up with these lesions occurring on the feet specifically, and these rashes on the feet around the time of the pandemic. And like I mentioned, a lot of these, the research studies were mixed. Some of these people who had chilblains-like lesions, they were positive, negative for COVID. And so there's still a lot of research that needs to be done around this condition. So let me just go here. Oops. Sorry, give me 1 moment. Okay, so in terms of the presentation of this patient, her tongue specifically is pale, puffy, slightly purple, and also teeth marked, very minimal thin coating with a red tip and sides. Her pulse was quite often very deep, weak, and thready. And so TCM diagnosis, definitely there's a lot going on here, but kind of narrowing it down to toxic heat pathogen accumulation with qi stagnation and blood stasis. And then we also see some liver yin and kidney yin and yang deficiency. Definitely there's a lot of spleen deficiency as well, spleen qi, spleen not controlling the blood. But these were just some of the main diagnoses that I observed in this patient. So the treatment principle was to clear the toxic heat pathogen, move qi and blood, and also to tonify, nourish liver yin and kidney yin and yang deficiency. So the treatment applications or approaches that we made were acupuncture, cupping, herbal medicine, topical herbal ointments, and an herbal compress. And this is an example of an acupuncture treatment that we do on her. So like liver 3, Sandra 5, LI 11, Life 4. You guys can see here. We also did treat the foot directly with needles. And so, points like Bao Fang. We also did Osher points around the lesions, not directly onto lesions, but we would surround the blisters that she would have. The herbal treatment that we administered, both internal and external use. So we had the Ultimate Immunity, which has Chaihu, Bansha, Huangqin, Renshen, Dacao, Jininhua, Banlangen, Gansao, and Shengzhang. And we also treated her with concurrently with Dangui Sinitang, which has Dangui, Guizhi, Shaoyao, Xixin, Gansao, Tongsao, and Dacao. And so these two formulas were the main two formulas that we utilized for her. We did update them on occasion, but it always, whenever she would have a flare-up, we would always, turn back to these two main formulas. And she would respond really well. In terms of external use, this was also a very important component to her treatment. So she was recommended to do an herbal compress daily. And so the herbal compress that we have at our clinic, primarily is for toxic heat, skin rash issues, eczema, dermatitis. And so we utilize this for her condition, and we saw very good results. Along with the skin repair oil, which she also used daily. So she would use basically the compress every day, but we would tell her to take a break after, a certain amount of time, after a couple of weeks of using. But she would continue with the skin repair oil and the clarifying cream on a daily basis. And so these are the products that she used. And so just to share with you her progress, so before treatment, this is what we looked at. And then about 1 or 2 months post-treatment, we noticed a lot of the skin color coming back. Now, I do want to mention, we mentioned that she had Raynaud's, and so oftentimes she would present to the clinic with, toes that would turn purple, and red because of her condition. And so, she did respond very well to the herbs because that was also being addressed with the Dangui Sinitang. And so, circulation was definitely improving with this patient. And as you can see, the toe did have a blister there, which you get on occasion. But the fourth and fifth toes, had improved quite significantly. And then this is the bottom of her foot. She was always so embarrassed about her feet because she was being treated with us. She was using the compress very often, and it would, it's draining out the heat with, herbs like Da Huang. And so she would get such discoloration and dryness in her feet. But she would continue to use them because they were so effective. But you can see at the bottom of her foot here, a small lesion there, which is not quite open, but this is kind of the area where she would have the sensitivity as well. Yeah, kidney 1. And then this is about 3 months was when we started to see, even more improvement. And so this is at the 3-month mark. And so pretty much her redness, swelling, the discoloration, the blisters were gone. And just to give you comparison, I gave you her right foot, photo of her right foot, just to compare, what her foot normally looks like. But at this 3-month mark, she was, very, very happy. She's been dealing with this for almost a little over a year now. And so she was very, very pleasantly, let me just say, she was very happy, that she was able to wear normal shoes again. She was able to wear, socks. She was able to sleep with the bed cover over her foot. She was able to start walking, doing yoga. And so, she was starting to gain back a lot of her normal lifestyle and activities. And with this improvement, we talk about, the whole psycho-emotional component. She was also sharing that she was not depressed anymore. Throughout the course of the treatment, she was, having some difficulty with feeling hopeful because she's had so many different interventions that weren't as successful. And so, she would feel very hopeless and depressed. But when she was seeing results, her mood started to get better. She started to feel less anxious. And so we also saw an improvement in her Shen. And this is pretty much on a consistent basis. So this patient was being treated for acupuncture and all of the other modalities for once a week. And she consistently came for her treatments every single week for the past year. And so, we saw such great progress. This is the right foot for comparison again. And then on this side, you see her left foot. And so you see some redness here, but her blisters are completely gone. And her swelling is also reduced. And most importantly, she does not feel pain. She will report on occasion that she will have small little bouts of pain, but definitely much less than before. So here. So in terms of her results, with the treatment of once per week, along with the herbal medicine treatments for about 10 to 12 months, her pain was about 90% reduced. And the frequency at which she would get the flare-ups were much, much less. She does, while I was seeing her throughout that year, she did get sick maybe once or twice. And in terms of her symptoms, they would be like mild sore throat, but it would last about a day or two. Previously, she would be sick for like up to a week, along with the extreme severe pain of her foot, but that was also very minimal. So yeah, that was my case. I know we have a few more minutes, but let me go back here, make sure I covered everything. So yeah, this patient was, extremely dedicated and committed to her treatments, which we are always, happy for. And, we definitely see the effects of that. We also obviously see the tremendous effect of the herbal medicine, both internally and externally. We witnessed during the pandemic that Chinese medicine, kind of had its resurgence and popularity, but we never really heard too much about, how it was being treated for skin issues, external issues that were presenting. And so seeing this case up close and personally was such a great opportunity and learning experience to see, okay, that patients are still experiencing these post-COVID symptoms, and a lot of these symptoms are very random, and primarily with skin issues, there's just not as much treatment options available, even at this point. And so when, the patient came to us to seek treatment, definitely we were committed to really helping her through this. And so I think, we just continue to see the amazing power of traditional Chinese medicine, and we're just continuing to monitor her and, hoping that her results persist. So far, so good. And so just wanted to share that. But thank you so much for listening. Did anyone have any questions or comments?
You do have a question in the chat, Stella.
Okay, let's see. So there are some questions. Okay. Okay, if you guys don't mind, I will go through each comment, if that's okay. So Valerie, hi Valerie. Thank you for your comment. You wrote, I just Googled chilblains. Yes. So it's interesting because the various studies that I was sifting through, it had kind of a mixed results. Some people were saying that, some research studies were saying that it affects only children. Some were saying it only affects adults. But interesting that you saw that the underweight women part with Raynons. Let me see here. Okay. Dr. Lee said that she put more than 10 needles on this patient locally. Yes. This was not the most favorite part of the treatment for the patient, but she endured. And yeah, we did quite a bit of needles on the patient. Okay, I'm looking for a question here. Oh, Dr. Mitra wants to know why you use stomach 7 as acupuncture point. So this patient also presented with tinnitus. And so that was just one of the things that I wanted to address. And so stomach 7 was one of the points that we used for that. And also migraine headaches. Okay, so that concludes the chat box. Any other questions or comments?
I have a quick question.
Sure.
I've been seeing a lot of people with tinnitus after getting their COVID shot. Because you mentioned this patient had tinnitus also. Did she get better with the herbal and the acupuncture afterwards? Did tinnitus go away?
So the tinnitus was, of course, more secondary that we treat a symptom that we treated. And granted, we do treat, the patient holistically. But in terms of her tinnitus, she did bring that up, in the initial stages of the treatment. But gradually, she would not mention it. And when I would ask her about her symptoms, she would mention to me that she wouldn't notice it as much. So, a little hard to say if it has, actually improved, just based on kind of the mixed response. But I mean, granted, the medical history of the patient, a lot of the times it is correlated with the tinnitus. And so, definitely the Dongui Sini Tang could be of benefit to patients, depending on the signs and symptoms that you're seeing in your patients.
Thank you.
Yeah. Okay, I will stop my share in that case if no one else has any questions. I'll turn it over to Casey.
Did you stop your share, Stella?
I think I did.
Okay, let me.
And we can also open up this time for any questions directly for Dr. Lee. I know, Casey, you're going to get into that, but
Yes. Yeah, so basically, yeah, so now would be the time for if you guys have any of your personal case questions or any other questions about the cases that were presented today, you can drop them in the chat box or you can chime in and we can start having Dr. Lee answer your questions.
and Dr. Lee, if you wanted to chime in, if you had any comments about our case, about our patient that we saw together, feel free.
Thank you. Thank you. Hey, everybody, can't see you guys, but so nice to have you here and have a good, evening. And today, we had the two of the cases to present by Kumiko and Stella, and a great job, and love it. And so, like Kumiko got the classical formula, and treating PMS and PMDD, and so it's got great results. And she basically mentioned to everybody, I think you guys still remember, because for a lot of female condition, and including period related and PMS, and also infertility. But remember, female woman is the blood is the foundation. So blood and the material, but the blood cannot move, need the energy to move. So 当归芍药汤 is the best formula, one of the best, and to deal with and most of the female conditions. And so when we use 当归芍药汤, just remember 5 words, 5, okay? Liver. So liver is related to the qi, related to the blood. So number 1, liver, just remember that. Number 2, spleen. Of course, spleen, and in the middle jiao, right? And that's the manufacturer, the part of the manufacturer of the blood. So also blood, of course, the T and T, and to regulating our water, metabolism, and all of that. So that's number 2. Number 3, remember water. And we always say, woman is like water. So that's true. So water and woman is like water, but at the same time, and the water can cause problem. And we have a lot of issues with water retention, and the water retention cause, all the, for example, PMS, like, getting weight, and sometimes even like menopause, your weight gain. It's a lot of that related to water, and water can cause a lot of blockage. So number 4 is dampness. It's dampness, okay? So dampness, and the dampness, of course, dampness water from the same source, and just different name, and they have different texture, and in different area, and which is it's the same thing. And number 5, actually, I should put this one. It's before that. It's blood. it's blood. So liver, spleen, blood, water, dampness. If your patient, anybody, have one of them and related to the disease, and done with 芍药散, that's the way to go. And so that's why it's so like easy to use it. And 桂枝茯苓, and this patient like Dr. Kumiko present and also have some skin issues like psoriasis. Psoriasis, the base of psoriasis is blood disease. So blood disease, and then 当归芍药散 can cover that, and 桂枝茯苓汤 definitely. And 桂枝茯苓汤 is target with blood, and especially blood stasis, and all of that. And so that's why these two formula, and it can, got this patient feel so much better, because just like if you open the main doors, all the other windows are open. So that's why when you resolve the problem, the main problem, everything resolved. And we do not need to target everything. Sometimes in the clinical, and the people target every single symptom. That's wrong. And you need to just open the main doors. If you get in that door, you can open the windows, no problem. So that's a great case. Thank you, Kumiko. And Stella's case, because this patient actually, I don't know, like Stephanie Young, you remember? Your office sent us this patient. I probably you still remember. So
She actually has a question for you on the chat before you keep moving forward. Stephanie wants to know, do you have any go-to formulas for brain fog post-COVID?
okay, post-COVID, good question, because I have quite a few post-COVID. Tell you the truth, I got quite a few difficult cases. And for post-COVID, my suggestion also from how I deal with them, I think, there is a few tips, and you maybe you want to use. And the most important, COVID, of course, as a virus infection, and it's really doesn't matter, how they get into the body and cause what kind of symptom, but eventually, and what happened with all the symptoms, remember, it's just our yang qi is not working properly. And why the yang qi is not working properly? Because our yang energy, I always emphasize, yang energy is so important. Doesn't matter how much toxin and there and the heat and this and that, but if they cause, block your yang energy, and your yang qi, just like the car, the engine is not working, you can't drive. Then you have no drive, and then your brain foggy, and you have no energy, and you have no motivation, and you just feel depressed, and start to just sitting in there doing nothing. And I have a few patients like that. So in that case, besides acupuncture treatment, and normally I use quite often I use like ultimate immunity, because this formula is 小柴胡汤 as a base. 小柴胡汤, that's the universal formula, right? And also it's great formula, and to deal with this, almost like a 三焦, and to promoting the qi, and at the same time you will see, the yang qi promoting, and to improve the immune system and supporting. And so 小柴胡汤 plus 金银花 and 板蓝根. So basically, and 金银花板蓝根 in that formula, and it continues and try to, just detox and clear certain type of the heat and, from the virus infection. So in the clinical, this formula, when we use that, it's got a really good results. And because, as you know, and sometimes even TCM, and we have to simplify that. And sometimes, modify this, modify that, and here and there, and so much, and it's very hard to regulating that. So, and one thing which is great, and the classical formula can really really kind of simplify that. And because the formula is simple, and also just as I mentioned, like 小柴胡汤, universal formula. It's really, depend on how you match with the other and you can go. So for post-COVID, so I use ultimate immunity, and at the same time, and I will add the other formula match together. And if this person, for example, have a lot of, let's say it's like brain foggy and no energy, and also have, a lot of water retention, and, all of the symptoms, I will use ultimate immunity match with 当归芍药散. Here we go. 当归芍药散 again. And if this person is get, a lot of depression, a lot of like for long term, like recently I have patient and post-COVID for 2 years, and it really kind of desperate. And he went to Europe and you're doing something like a dialysis, and kind of theater, like the blood come out, because in here nobody wanted to do that for him, and he went to Europe, did that, and but come back after a couple months, and like in the first couple months feel great, after a couple months all the symptoms back again. And so right now I'm treating him, and basically that's the formula, but his condition is quite deep. And right now from like ultimate immunity and 当归芍药汤, now I'm changed to the second one, which is, he's feel better. Second one is still ultimate immunity, but I start to use 血府逐鱼汤, because, for this kind of condition and lasting for so long, and you have to thinking about any condition, if they last for a while, doesn't matter you say the blood stasis or not, there is blood stasis. You have to get into the blood stasis. So start to, use something like a 血府逐鱼汤. It's not only just for, blood stasis, but it also can open up like the chest. And then the chest is, the heart in there, and the heart center. It's just like open up the window of yourself and letting the sunshine get in. So that's kind of like deal with all the deep depression, which is, you can get really good results. So that's what I'm using. And number two, and this patient, we also, the treatment, I found out for post-COVID patient, you need to do a lot of the lymphatic system drainage. So lymphatic drainage, you can use acupuncture, and you can use cupping, you can use, like a guasa, and you can use manual therapy. And this patient I just mentioned, and I use a lot, like, besides of the acupuncture points, and I use like the cupping and the front and the back. But most important, remember, if you do the front, cupping the Ren channel, cupping the, like the collarbone below, and the first and the second and the third, even fourth of the ribs, okay? And cupping that, and cupping the axillary area, and from, for example, like, spleen 21, GB 22, 23, 25, all this area. And I guarantee you, you will get so much, like, faster results. And when you do that, because the patient feel like, wow, every time, you dump some garbage from their body and they feel lighter. So that's my suggestion. It's just from my experience. And I don't, that's
Thank you so much, Dr. Lee. We do have 2 other questions. I just want to make sure that we have time to answer those 2 as well. The next one is from Natalia. Dr. Lee, could you please tell if you treated I'm sorry, I'm going to butcher this, melanoma patients after surgery?
melanoma. Oh, melanoma patient after post-surgery of melanoma. Is that right? Okay.
Yes.
Yes. So,
yes, it's right. It's right, Dr. Lee. Thank you.
okay. So it's dependent in which, number one, location, right? And which location. Number two, how big. And number three, how deep. And so, and for the post melanoma patient, the treatment, you have to use both internal and external. Internal and external. And also for melanoma patient, post melanoma patient, post surgery. And again, besides the internal, external, I would suggesting and open up and to kind of unblock the lymphatic system, also very, very important. Doesn't matter what you use. And, and to always unblock. But for internal, and, my suggestion, which is internally, if you deal with that, and thinking about the melanoma and the cancer and why they cause that, we always try to figure out and why, and this person get this, and what's happened, and what did the body change. Any of the cancer, it's stagnation. It's the blockage, it's the stagnation. And the stagnation and the pulling out of the toxic and accumulate together. What kind of toxic accumulated? And again, there is like the chi, of course, and there is water, there is dampness, there is flame, and there is blood. So all of this, and it's kind of like, it's not like our body can make those of sense in one day, in 1 month. It's taken years of the unhealthy or certain sense. It's taken years to make it and to build up it. So it's not like short term. So the body is like when you're treating this kind of patient and to prevent, because melanoma, the biggest risk is sometimes if it's too deep and very silently, and they start to damage it. For example, target like a liver, and the other target like an eye, and it's in the other organ system, and that's the target. So they will be very silently. Even you say, oh, nothing kind of should I worry, and they already start to silently and make a movement. So right after surgery, I think we need to really kind of like let the patient know, and then how to prevent. It's not like okay, after cut off, we done. We are way not done. And that's just the beginning of the journey, I would say. So internal, external, and lymphatic unblock. So internal, and my suggestion, you have to supporting the righteous chi, the Zhen chi, you have to. And number two, you have to kind of unblock and remove of all the kind of like accumulated, I just mentioned, like water, blood, and dampness flame. So all of this. So because I'm kind of, more like I use classical formula is more. So basically, patient actually, again, like a dangui soil sign, you can use that. You can use that. I want to mention that again. Dangui soil sign, if you use this formula and think about it, if it is matching with your patient, and liver, spleen, blood, water, dampness. Just the 5 words. And if your patient, have that, no problem, dangui soil sign. At the same time, and because, melanoma also related a lot of like the flame accumulated, I would use dangui soil sign. And according to different level, and because you see this patient, you will know better. And I will in different level and, kind of combine with different formula. For example, if I use dangui soil sign combine with Wendan, it's more clear up more of the, like the flame and the water and those kind of things, and also can unblock the lymphatic system. And if you feel like the patient, I want to go a little bit, deeper in the blood level, and you can use for blood, the choice, like 桂枝茯苓汤 is one of the choice. And the other choice, like, 血骨足鱼汤. And if it's kind of strong, you want something, sometimes occasionally give a little bit like a push. 桃和承气汤. It's wonderful, wonderful formula you can use. So it's depend and in what kind of situation, but you always you decide which formula to use. After 当归芍药散 and to get a patient in in the other level, I would say you can start to use like to maintenance ultimate immunity. That's remember 小柴胡汤 plus 金银花 and 板蓝根. We have the formula here. And externally from the surgical area, and as soon as possible, start to use like the skin repair oil, because that can, from surface and the healing of the post-surgery and the cut, and also at the same time that help they recover. So you can do that, and don't forget the lymphatic drainage. And for this kind of patient, it's very important. Hope that's helped.
Okay, Dr. Lee, one more
Thank you.
question. And
Thank you so much. Thank you, Dr. Lee. Thank you so much.
Problem.
Okay, Dr. Lee, one more question, and it's going to be from Valerie. She's saying, so are we assuming the skin issues are coming up with COVID because the lungs are in charge of the skin? But why are we seeing so many issues with the ears?
So many issues with the ears. What?
Yeah, she says, but why are we seeing so many issues with the ears?
And like a ear infection, tinnitus, raining.
Valerie, if you want to chime in, I'm not sure if you're still
Let Valerie talk. Hey, Valerie. Hello.
let's see.
Okay, let me say the question. Where is the question? And do you have any go-to formula? Oh, okay, that already answered that. Valerie's question. Okay, because the none are charge of the skin, but why don't say so many issues with? Okay, so I think Valerie, yeah, you are right.
Sorry, she says ear congestion and tinnitus. I can't get the mic to work. She says she can't get her mic to work.
Oh, okay. That's fine. And so again, and the COVID, and after infected COVID, and basically the lung is one of the target. Lung is one of the target. But our body, remember, you said like I saw more skin condition and post COVID, and I saw a lot of especially female with hives, and also more of the dermatitis. So after COVID, and the thing is, you mentioned that it's because the lung as a target and the lung connected with skin. Yes, that it is. That makes sense. But at the same time, and don't forget, and the COVID, it's kind of like what is really deeply getting into our body, and it is the kidney. It's really the kidney, and so it's really deeply affected our kidney essence, and that's our just like as we know, and kidney just like our you put money in the bank, that's our saving, right? And the COVID, and when we infected the virus, and our body have to deal with that, and it need a lot of energy. And this kind of energy, again, I would say a lot of young energy. And this energy, it's kind of when your energy, like the target is in the lung, especially with the function of the qi, and your lung is totally collapse, and it's failed to work. And then they need to, and calling, the saver, and the calling, help. And where they go? And you have to pour out from your saving, from the kidney energy. So that's why for the COVID patient, the post-COVID, and they are exhaustion and extremely tired and for a long time and couldn't recover. And why? And because you really damage the deep of the foundation, and that's the kidney. So in that way, it's easy to explain why you have ear raining, because the kidney is open to the ear, right? And now your kidney cannot even support, and your saving is, you know, kind of pulling out everything empty, and there is nothing in there. So they cannot really support the chi, and the chi start to get a little bit of collapse, and from the ear, and that's cause, you know, tinnitus and ringing in the ear, and some people even, you know, the hearing loss, you know, all of that start to appear. So that's my understand.
Thank you so much, Dr. Lee. So let's go ahead and conclude today's session before I let you guys all leave. I do hope that you found these cases to be enriching to you. We will be holding our next CEU on Thursday, April 25th, honoring National Infertility Week. Guest speakers will be MD Dr. Thomas Kim from RMA Southern California and Dr. Kumiko Yamamoto, licensed acupuncturist and reproductive medicine specialist. Before we conclude, I do also want to add that I've personally witnessed practitioners elevate their practice by mastering the art of prescribing herbs to their patients. Herbal TCM's mentorship program, I do want to point out, facilitates ongoing consultations, empowering practitioners like you to refine their clinical and herbal skills. We would also love to invite you to our next event coming up, actually this weekend. It will be held at Yosan. We will have a booth that you are all welcome to come, and you can explore more of our formulas and creams that Dr. Lee has made. Don't forget also as well to follow us in all our social media platforms, as well as now we have a YouTube, which you will be able to find this recording of this class today for any of your references. Thank you all for everybody who joined, and we hope to see you in our next events. Thank you.